This is a summary of the Behavioral and Cognitive BABCP Journal, Volume 45, Issue 05, September 2017. It's quite old. Okay, so I'm just going to run through the abstracts of journal articles. Do symptoms of irritable bowel syndrome improve when patients receive cognitive behavioral therapy for comorbid anxiety disorders in a primary care psychological therapy IAPT service? Kenwright, McDonald, Talbot, and Janua. Bills. Irritable bowel syndrome, IBS, is a common comorbid condition with anxiety disorders. Patients often report a fear of incontinence in public places. This type of bowel control anxiety, BCA, bowel control anxiety, can be conceptualized as a phobic syndrome. Yet, little evidence exists on the prevalence or outcomes of these comorbidities in routine primary care psychological therapy, IAPT, services. The aims are to examine the prevalence and outcomes of IBS and bowel control anxiety patients treated with cognitive behavioral therapy for anxiety disorders within IAPT. It was an observational cohort study, screened 2,322 referrals to an IAPT service over 12 months for the presence of IBS. Patients with comorbid anxiety disorders and IBS were grouped into those with and those without bowel control anxiety. Patients completed the IBS Symptom Severity Scale and the IAPT Minimum Dataset. Diagnoses and outcomes were examined for all groups up to 6 months follow-up. The results were that a greater portion of bowel control anxiety patients had a primary diagnosis of phobic disorder. After receiving CBT, patients made clinically significant improvement in both anxiety and IBS symptoms at 6 months follow-up. Patients with bowel control anxiety made greater improvement in phobia scales and IBS symptoms than non-bowel control anxiety patients. Conclusions being anxiety disorders with comorbid IBS improved significantly in a routine IAPT service. A significant proportion of comorbid IBS sufferers had a fear of incontinence in public places, bowel control anxiety. Directly addressing and modifying these fears with CBT appeared to enhance improvement in both phobic anxiety and IBS symptoms.